On the 1st of May, the Cabinet Secretary WhatsApped you to say, "Hi, Matt. Well done this evening. Creative counting and 122,000. You respond, although it looks like question marks. In fact, it was a 3-kiss emoji.
I told you we got on well.
Well, yes, but you appear also to be accepting his perhaps jocular observation that you'd engage in creative counting.
This reference is about how we went about counting a new innovation, which was tests that people did at home, on which there was work in the department. The permanent secretary...
Mr. Hancock, I'm so sorry. In the interest of time, can I just ask you, and I'm doing this in order to be scrupulously fair to you, do you accept or reject the suggestion of creative counting?
I reject it, and on every different way you could possibly count these measures, we hit that target.
Can you help us with your experience of Mr. Cummings in practice? Let me read you one sentence of Mr. Javid's witness statement. He said this: "I felt that the elected Prime Minister was not in charge of what was happening in his name and was largely content with Mr. Cummings running the government." Do you agree with that?
No, I don't. But let me just say at the outset, and I don't say this as any disparagement on this committee or this inquiry, but there's a whole circus that can be built up in the media and elsewhere around the internal battles between individuals. And some of that is natural and healthy. You know, you have tensions between civil servants and SPADs, between all of those and ministers, and of course between ministers. I, by the way, worked very closely with Sajid Javid. In fact, I worked for him when I was housing minister. I like him, I respect him. I think he's a great operator and decision maker in the way we were just describing. So I got no beef with Mr. Javid. But equally, I don't think that's quite right. I think Dominic Cummings, certainly on diagnosis, but also in trying to galvanise direction of travel, was much needed, some grit in the oyster. I think if you look at some of the things he said, we may come on to this, but the obvious one I think of is the osmosis between professions from outside of government in government. Funnily enough, Chris Whitty and Patrick Vallance are great examples of this. I mean, when we came on to the vaccine trials and all the rest of it, having someone who has not only been a scientist, who knows how government works, but also been in a major multinational, taking a drug from trials to commercialisation, I mean, it's just gold dust. I think Chris Whitty was superb as well. And one of the things I think Dom Cummings had noted and observed is sometimes Whitehall can feel a bit like a closed shop. So I want to give you a sense of which I think he correctly identified some of the structural challenges without getting into the he said, she said, frankly, soap opera of Westminster bubble politics. The broader question you raised about whether he was actually, Boris Johnson was a puppet, I'm afraid I don't find that a serious allegation. I think Boris Johnson certainly relied on his key advisors. By the way, I think you have to, if you're going to get through the work, particularly in a pandemic. I don't think, looking back at Prime Ministers past or present, if I look at Theresa May, or if I look at Tony Blair and the role of his Chief of Staff, his Director of Communications, it is natural. And if you present me something in a specific scenario, I'm happy to comment on it. But and Boris, just like anyone else who occupies that incredible role, and I feel some empathy with anyone who's done the job of Prime Minister, because I covered it for a month, and I think that made me a better Secretary of State because I could see quite what the pressures were the Prime Minister has to deal with. But you've constantly got this challenge of wanting to control the levers that affect government policy, but also knowing that to run an effective government, you need to delegate. And of course, you should delegate fundamentally through your Secretaries of State and your ministers, but you also delegate with advice and reliance on your special advisors, just as you do through senior members of the civil service. That is natural and proper, and I just don't accept the characterisation that there was some sort of puppet regime.
If we look first of all at the email at the bottom, which is an email written by someone called Rosamond Roughton to you, she says, "Dear Jenny, we estimate that approximately 2/3 of people in care home are over 85. When we introduce the shielding policy, what should our approach be to allowing patients to be discharged into care homes who are symptomatic of COVID-19. My working assumption was we would have to allow discharge to happen and have very strict infection control. Otherwise, presumably, the NHS gets clogged up with people who aren't as acutely ill. And your response on the same day, you say, whilst the prospect is perhaps what none of us would wish to plan for, I believe the reality will be that we will need to discharge COVID-19 positive patients into residential care settings for the reasons you have noted. You say it'll be entirely clinically appropriate because the NHS will triage those to retain in acute settings who can benefit from NHS care. And you say the numbers of people with disease will rise sharply within a fairly short time frame. Just pausing there, do you mean to say the number of people with disease in care homes?
No, I've read in the population, this was the context of this. This was almost sort of, it was exactly that week where the numbers were starting to rise exponentially, and it's that context. This is a very high, this is not a policy statement, this is a high-level view that says, Ros was the director for DG for social care in the Department of Health at the time, and it was very much... it was a very bleak picture because I think the reality was this isn't an invitation to be discharging COVID patients. It's actually a reality that says if hospitals overflow, those who can benefit from treatment there will be there. Anybody, it doesn't matter whether it's residential care settings or going home or going on to other ones, that hospitals will have to manage that those who are physically well to go will
Yes.
go.
Well, let's just finish off the email and then I'll ask you a question.
Yep.
So the reference to the sharp rise, I think you've explained just a general...
Absolutely, population.
But no doubt including in hospitals.
Yes.
And so you say you suspect that within a fairly short time frame, you suspect that will make this, which I think you must mean the discharge of symptomatic patients into care homes, fairly normal practice and more acceptable. But I do recognise that families and care homes will not welcome this in the initial phase. Now, of course, much of the debate about discharging patients from hospital into care homes is about asymptomatic patients. I'm not asking you about that. This email is about discharging people who are symptomatic, who were known, or at least strongly suspected, to be suffering from COVID.
Well, it actually says COVID-19 positive patients. So I'm anticipating from this that what will happen is the rate of increase in people in the population with COVID will rise absolutely exponentially. That was the data that we'd seen. That hospitals would do their best with this, and that we would have some patients who potentially had gone through the most acute phase, actually were still positive, but then would be of less need, would no longer need acute care, and obviously hospitals will be treating those then that they can treat, and these individuals would be safe in terms of their physical welfare at the time to move on, and otherwise there wouldn't be places for other people from care homes to go in and be treated.
One understands the logic and the need for this discharge, or at least the case that's made for it. And as I say, I don't want to get into all of that. But on any view, what is being discussed in these emails is discharging symptomatic COVID-19, quite possibly infectious COVID-19 patients into care homes.
So just once again, COVID-19 positive patients, not symptomatic patients, because I don't think they have ever been...
Well, I only use the word symptomatic because that's a word that Jenny Rowton used. I don't want I don't want to get tied up in...
No, but I mean...
People who've got COVID were being discharged into care homes.
This sounds awful. This is taking a very, very high-level view that says if we have this enormous explosion of cases in the population, as you see, there will have to be a national triage. And I think what I was trying to do was explain to us what the size of the problem might be. I don't think it had actually quite registered. The other thing I would just like to point out is there's a really critical point, and that comes through guidance as we go through, in her email, which is about my working assumption is we'd have to allow discharge to happen and have very strict infection control, and that is the critical point.
Yes. There are repeated references to how in February and March you were, quote, desperate to own and lead that you kept too much in the DHSC, that you were reluctant to explain that there was a risk of the NHS becoming overwhelmed, and you were bad at asking the Cabinet Office for help. You were aware of the material. Does that not all rather suggest that in those vital days of January through to March, the DHSC failed to tell central government how bad it was and what could be done to address the question of infection control?
No, that's completely the wrong way round. From the middle of January, we were trying to effectively raise the alarm. We were trying to wake up Whitehall to the scale of the problem. And this was a problem that couldn't be addressed only from the health department. Non-pharmaceutical interventions cannot be put in place by a health department. A health department can't shut schools. It should have been grasped and led from the centre of government earlier. And you've seen evidence that repeatedly the department, across the department, and I tried to make this happen. And we were on occasions blocked, and at other times, I would say our concerns were not taken as seriously as they should have been until the very end of February. So, for instance, the very first time I tried to call a COBRA, I was blocked, ultimately only for 48 hours, because I then went to get other voices to call for a COBRA, and it happened. And getting the machine at the centre of government up and running was incredibly hard and took a huge amount of effort. When it did finally get up and running at the end of February, then things started to move. And so I've heard these accusations that we tried to do too much. On the contrary, there was so much that needed to be done, and in some cases we just had to get on and do it. It would have been far better if, instead of thinking that we were overreacting, as the COBRA machine clearly thought we were, if they had embraced the challenges and it had been led from the centre. If I think had there been under another regime, under another cabinet secretary, I was a minister under David Cameron, under Theresa May. The centre would have chaired those early COBRAs. Yes, of course, I, as Secretary of State, would have played a big part, but it would have been a cross-government effort. And in future, that's what it should be. The lead government department model works very well for small crises, for medium-sized crises, but it does not work for a crisis that is a whole of government, indeed a whole of society crisis.
Michael Gove at the top, and then there are references to Dom, obviously Dom Cummings. At 1948, on the 4th of March, so 2 days after the COBRA, you know me, I don't often kick off, but we're fucking up as a government and missing golden opportunities. I will carry on doing what I can, but the whole situation is even worse than you think, and action needs to be taken or we'll regret it for a long time. Expand, please.
I was concerned at that stage about the ability and structure of the Cabinet Office overall to deliver on the government's priorities. COVID was in my mind, but it wasn't the principal thing that I was messaging about. It was about the Cabinet Office overall, including its ability to deal with COVID. I apologise to you and to the inquiry and to the public for expressing myself in the way that I did. I'm sure that you'll understand that this sort of thing happens.
Well, speaking for my part, no apology is required. But the point is, Mr. Gove, you are obviously concerned about the general position of the government. And
yes.
On the 4th of March, what
yes.
was the most pressing concern of government?
Well, it was the coronavirus, but I was concerned about the Cabinet Office overall. I don't want to suggest that I was a perfect clairvoyant, very far from it. But it was the case, and I think I also emailed Mr. Cummings around this time as well to point out some of what I believed were the defects in the way in which the Cabinet Office operated. And I made the point then that the situation with coronavirus would only further expose the weaknesses in how the structure of government was set up.
Of course, when it comes to February later, when we will deal with that in due course when you resign, there's also a reshuffle that takes place then with new ministers being appointed. Is it fair to say that you were one of the most experienced ministers at that time in January and February of 2020 within Cabinet?
I think that would be fair, yes.
What you also say in relation to those issues is that the Prime Minister's office was not as strong or expert as it could or should have been. You described the team as being too small. Again, so this is looking at the Prime Minister's office, number 10. Why do you make that observation?
I would actually make that observation of any Prime Minister's office that any Prime Minister that I've served. So, as you alluded to earlier, I've served 2 other Prime Ministers, and that is because I found, certainly from someone sort of, especially when I first came from the private sector into government, being quite surprised with how small a team a Prime Minister typically has, in terms of there's the political advisors, which is typically a small group of it differs for every Prime Minister. It could be 10 to 20, maybe 25 or 30, but it's a relatively small group given the responsibility of the Prime Minister. And the civil service team is also relatively small compared to individual departments, for example. And that you will undoubtedly then have an impact of the Prime Minister and his or her team to then be able to deliver on the commitments of the government of the day.
Do you see that as one of the structural deficits within the setup of number 10?
I think it's an issue. Now, it has been said, other people have discussed this similar situation, might say that, but then there's the Cabinet Office. And then there's a minister, typically the CDL, the Chancellor of Duchy of Lancaster, will lead the Cabinet Office. And the Cabinet Office is there to sort of help coordinate initiatives across government to support the Prime Minister with his or her priorities. But then the Cabinet Office is also led by a member of the Cabinet, and whilst it is very responsive to what a Prime Minister may want them to sort of focus on and advise on, that head of the Cabinet Office will also have their own set of priorities. So it's not the same thing as being an extension of the Prime Minister's office.
So there is a distinction to be drawn effectively between the two in the way they work and things, policies that they are developing.
Yeah.
If I can turn now to looking specifically at the Cabinet and number 10 initially, as it existed in January and February of 2020, the outset of the pandemic, and call up your paragraph 37 again, please. What we see here is that your view was that Cabinet at that time was designed to place Dominic Cummings and the Prime Minister as the decision makers. The goal was to centralise power in number 10 with a preference for loyalty over experience. Now, you talk about the centralisation of power and decision making. Was that something that you were privy to at that point in time?
Yes, that's how I felt things were. They were very centralised.
And did that result in other ministers, including Cabinet ministers, being excluded from decision making?
I think sometimes it would have, and obviously a lot of I wouldn't have been privy to all those occasions. But the reason I say that is because it was clear that in Mr. Cummings, the Prime Minister had picked someone that he had decided to, for whatever reason, to trust with a huge amount of responsibility and power. And many times I felt like that many of the key decisions were being made by Mr. Cummings and not the Prime Minister, in a way that I had not seen with any other Prime Minister, certainly that I had worked with.
We have seen from the emails that I wasn't, and the messages I wasn't aware of at the time, that clearly flipped over into an unhealthy, toxic culture at the centre, where anything that went wrong was seen as a almost intentional failure. And worse, that amongst some people, misinformation about what the department was delivering was spread, including to the Prime Minister and at the very highest levels. So a healthy culture involves challenge and scepticism. An unhealthy, toxic culture involves a failure properly to engage, and instead throwing of false allegations and and extremely unpleasant language. What you'll notice when you go through all of the documents is you just didn't have that within the health family. I tried to lead a positive culture, a can-do culture, where if there was a problem, the question that was raised in the department was, how do we fix this? Now, that didn't happen all of the time. Of course, there were moments of frustration, but that was my overall attitude in this areas I led. And you can see, unfortunately, that we rubbed up against this deep unpleasantness at the centre.
Scotland, Wales and Northern Ireland receive funding more generous per capita than England. And on top of that, it is also the case
Mr. Gove,
let me finish.
No, Mr. Gove.
I know, I think it is important.
Mr.
I think it is critically important that I make this point, that furlough was UK-wide.
Mr. Gove, I asked the questions here, please.
Pause, please. Just pause.
You are aware that my question is framed in the context of whether or not there was a significant problem in the context of the coronavirus crisis and whether devolved administrations felt that this issue of fiscal support was properly addressed. The question was not designed to elicit political views on the Barnett formula or the amount of support given to the devolved administration.
I'm dealing in facts, Mr. Keith, and they're facts which are relevant.
Mr. Gove, if I have asked
Mr. Keith, let Mr. Gove just, as long as you can answer it shortly, Mr. Keith,
yes,
right, because we need to move on again, I think.
The essence of the charge is that the devolved administrations did not have enough resource. It is the case.
No, I'm so sorry to interrupt. I have not asked you about the quantum of support. I'm merely asking you to acknowledge that there was a problem that rumbled on, that was required to be addressed, was taken to prime ministerial level, of course, because it is in the nature of a devolved structure dealing with a national crisis that this sort of fiscal issue will arise. That is all I'm seeking to adduce. I don't want a lecture on the merits of the Barnett formula. Was there a problem which the United Kingdom government had to grapple with in the context of the response to the crisis?
On Thursday, the 12th of March, there was another COBRA meeting. We can look briefly at another of these email exchanges. 1118843, please. Quite a familiar exchange by now at the top half of the page. An email on that day, early at lunchtime on the 12th of March, to Claire Brunton, asking if you could attend. Presumably the meeting was in the afternoon. Simply repeating the request, really, and saying we think it's important he's there representing London. And the answer comes back, checked with the team, I'm afraid not. You've already described your frustration at not having been at the earlier meetings, presumably coming the day after your meeting with Professor Whitty. Perhaps you were even more frustrated at that.
Well, can I just go back to a point you mentioned about the powers or lack of in relation to NPIs? So the only powers I had was to do things like enhanced cleaning on the underground, which I did that week, cancelling St Patrick's Day on the Sunday. So, and that's me not being properly briefed by everybody, but just by the CMO. So, yeah, so frustrated is a fair understatement.
We then go into the weekend. You've mentioned you cancelled the St Patrick's Day event. There was yet another COBRA meeting on Monday the 16th. Of course, the inquiry has had a lot of evidence about meetings and so on that took place at Downing Street in the Cabinet Office on the Friday the 13th and then over that weekend, in fact. But then there was another COBRA meeting on Monday the 16th of March, and on this occasion you were invited to attend. Were you given an explanation at that point as to why you were being invited then but hadn't been invited previously?
No.
Let's look, if we may, back at your witness statement where you provide an account of that meeting on Monday the 16th. It's paragraphs 82 and 83 on page 19 of your statement. We can see then at paragraph 82, you refer to attending that meeting on the Monday, the 16th. You refer it being stated at the meeting that London was, quote, a few weeks ahead of the rest of the country. And then in the paragraph below, you say that this was a moment you'll never forget. Can you expand on all of that for us, please?
I mean, I was told for the first time by the Prime Minister and others how bad things were. I'd been briefed by the CMO the week earlier, but not with the colour that the COBRA meeting presented the challenges in London. We're now told that just the concentrations of the cases in ICUs in London are really serious. The Prime Minister is using words like, this is the biggest challenge we're going to face since the Second World War. Draconian measures are going to be needed. And this is not in any way, sort of delusions of grandeur, but I'd been kept in the dark as the elected Mayor of London. And I felt almost winded in relation to what was happening in London, but also realising there are things we could have done in relation to some of these issues. Some we did, St Patrick's Day, enhanced cleaning on the underground. Others we didn't do. And I was quite clear, not in any way to sound panic-driven, but I was alarmed by what I was being told in relation to where we were and where we may go to. And I will never forget that sort of feeling of lack of power, lack of influence, not knowing what's happening in our city.
Now,
So can I just ask what you would have done? I mean, you'd been told on the 11th of March by the CMO that there was going to be a global pandemic and it was coming to London and the impact was going to be huge. You said you had limited powers. Supposing that message had come from government as opposed to Chris Whitty, who obviously is a government employee, what would you have done differently in those 5 days?
Some of the things that happened subsequently. So it was me that lobbied the Prime Minister to go to lockdown. It was me that lobbied the Prime Minister in relation to the inability to keep social distance on public transport, so people shouldn't be using public transport unless they had to.
So we're talking about lobbying. We're not talking about specific actions because your powers are limited.
Well, that's the joy of COBRA, my lady, that you can put your views forward to people with the power and they can take power. So because COBRA is chaired by the Prime Minister, he can act, if you like, as a referee between different points of view between the Cabinet, but also he takes some more representations from somebody at the coalface of London and can respond. So I'll give you an example in relation to some of the lobbying in the absence of power to the Prime Minister that led to action. The lockdown was...
Well, I think Mr O'Connor's going to come to that. I'm sorry, my question may have preempted.
The point I was making, my lady, was had I been at earlier COBRAs, I could have pointed out some of the reasons why community transmission was going to accelerate in London. Because I wasn't present there, those views weren't heard and weren't responded to.
129458 is a WhatsApp from you to Simon Case. Just want to let you know directly, we've had lots of feedback that Eat Out to Help Out is causing problems in our intervention areas. I've kept it out of the news, but it's serious. This is you, Mr. Hancock.
Yes.
Have you told Rishi? And then Mr. Case says again, I don't think he can afford to extend it. And then you, yes, we've told Treasury. We've been protecting them in the comms, and thankfully it hasn't bubbled up.
Yes.
So the position you took was indeed that it was serious, that's your word.
Yes.
That you told the Treasury.
Yes.
But whilst you did so, you protected the Treasury in the news, you concealed your concerns about the seriousness of the impact of this scheme, and you expressed thanks, gratitude, it hadn't come to light.
That's because I abide by collective responsibility. And I was being encouraged by various journalists who would presume that I was against it to criticise the then Chancellor. But I believe that government is a team effort. And so I didn't want that to become a row in public. I mean, you can see during the whole pandemic the corrosive effect of leaks. I was not part of that, and I don't appreciate government by leak, and hence I abided by collective responsibility on and off the record. That's what I'm saying there.
As we are all aware, in the autumn, rates continued to go up, prevalence went up. There was a rule of 6 introduced. In the context of this debate between relaxation, promoting the economy, and caution and keeping R below 1, did the Prime Minister take a consistent approach to one or the other sides of that argument?
I think it's fair to say that the Prime Minister felt strongly the arguments for the protection of health and the arguments for liberty and the protection of the economy. My particular beef was that I didn't think there was a trade-off at all, and there wasn't. It wasn't an either-or. You couldn't choose between either. And my intense frustration was that economists at the Treasury and elsewhere couldn't see that although you could protect the economy by not locking down this week or next week, the consequence, the second-round consequence of that, would be a firmer, more economically damaging lockdown in the future.
If my lady were Secretary of State for Health and chairing COBRA, any of us would ask of other government departments, what are you doing? So one would ask of the Education Minister, are we certain that policy X is being followed in schools? One would ask of the Defence Secretary, is it possible that we can deploy the military in this occasion? But the Health Secretary, him or herself, is not being questioned or held to account in that process. And I believe that that's the wrong model, that the Health Secretary or the Home Secretary, if it's a terrorist outrage, or the Environment Secretary, if it is a animal or plant disease outbreak, should not be the person chairing COBRA, but the person reporting to COBRA. And it should be a Cabinet Office Minister or the Prime Minister who acts as the chair, interrogating all government departments, seeking to ensure that ancillary departments support the lead department, but also questioning the lead department on its responsibilities and management.
Was there a specific issue in this regard in relation to the Health Ministerial Implementation Group? Because Mr. Hancock chaired that MIG and therefore was to some extent, in the way you described, marking his own homework.
Yes, and I would say is a structural weakness because, as I mentioned earlier, I have a high opinion of Mr. Hancock and believe that many of the decisions that he made were right and displayed foresight and wisdom.